Hello everybody, my name is Heidi Rosado and today I'm going to be presenting a research study indicating the return of bowel sounds as an end to postoperative ileus. So a little bit about the background or the history behind this research study. The loss of gastrointestinal motility after surgery is also known as postoperative ileus or POI, as some refer to it. And postoperative ileus causes a buildup of gas and fluid within the GI tract lasting 3 to 5 days after abdominal surgery. Since the 1900s, nurses and other clinicians have auscultated for the return of bowel sounds after surgery, and they have been trained to do so as an indicator, or they have used this as an indication of the resolution of postoperative ileus. And this long-lasting nursing tradition is challenged by current evidence-based literature, according to Massey. The research purpose: essentially, the study is of great importance because it seeks evidence concerning the return of bowel sounds as an unreliable indicator of the end of POI. This study provides evidence from randomized clinical trial, rationale supporting evidence-based inquiry concerning the return of bowel sounds as an unreliable indicator of recovery after surgery. The research problem is the comparison of bowel sounds returning to a specific indicator, such as first, postoperative ileus flatus has not been previously researched prior to this study. Standard care interventions believed to resolve postoperative ileus is to have the patient get out of bed, walk, beginning the first post-op day, as we all know. A rocking motion using a rocking chair is believed to reduce the duration of postoperative ileus and was also used in the design of this study. The study's primary aim was to examine the difference in duration of postoperative ileus as indicated by time to passage of first flatus in days between two groups of patients recovering from GI surgery. A secondary aim of the study was to determine association between day bowel sounds were heard within the day of the passage of first flatus. The participants used in the study had to meet some criteria, such as patients with digestive system cancer scheduled to undergo abdominal surgery were the ones that were primarily used. They also had to be English-speaking, cognitively intact, able to ambulate and sit in a chair or rocking chair, able to receive patient-controlled intravenous or epidural analgesia, and those agreeing to participate were randomized to receive either the standard care, which was the non-rocking, or the standard care plus the rocking intervention. A total of 66 patients were enrolled in the study and randomized either to the control, which was the non-rocking group, or rocking group prior to the surgery. Data collection and analysis. Assessment of bowel sounds and passage of first flatus was monitored and recorded beginning first post-op day. Date and time was noted, and all data was documented on a study data sheet by the primary investigator. The results findings indicated that time to first flatus and return of bowel sounds for combined groups were not associated. No significant difference was noted, and there was no correlation between the two. Nursing research regarding correlations between auscultation of bowel sounds and resolution of postoperative ileus are limited. Therefore, nurses and other clinicians must rely on tradition or current practice as an indicator to an end of postoperative ileus. There was no limitations noted in the study by the author. The data analysis was not identified specifically. There is no guarantee that this research findings are applicable to a larger population because only 66 participants were included within the study. According to Burns and Grooves, generalization is the extension of implications. of the research findings from a sample study to a larger population. Some nursing implications. Based on the finding, nurses should approach the use of return of bowel sounds with caution as an indicator of the end to postoperative ileus after abdominal surgery. In conclusion, the results of this study question traditional nursing practice in regards to auscultation of bowel sounds as a resolution of postoperative ileus, and also future research is needed in order to find best indicators for the end of postoperative ileus. And those are my reference. Thank you, everyone.